to the cloud. I think it'll give you the option. Yeah.
All right.
So I see
we're recording now. Perfect. Got our smiles on our faces.
Yay.
All righty. Let's do this. Hi, everybody. Again, thank you for panelists for joining. This is, again, my second time hosting. I hosted about 2 weeks ago on the COVID-19 and its impact towards diversity, equity, inclusion. It was very successful, so I just wanted to continue the discussion. So again, I'm Anthony Paradiso, and I'm going to go over our panelists soon. Their bios are all here, and they can just, on their own voices, can just tell you about themselves. But I just wanted to, my main thing really here is just to continue the conversation surrounding diversity and inclusion. It's, you know, we're in trying times right now, and I know there's so many issues that are going on, but I just don't want the D&I part of it to stop. So I want to just keep on the conversations. Any questions you have, feel free to write it in here. The panelists can see it as well as myself. So yeah, so let's just, this is about me, just a little bit. I just started my own company, AllThingzAP, where my specialty really is just diversity and inclusion and making sure that everyone is their full authentic self. I'm not going to go over the whole thing because we're here for an hour only and I don't want to bore you. So this is about me. And just a little bit, I want to just, when I do speak, I want to just, want to be vulnerable as well. I was raised in a working class family, husband, uncle, first generation college grad. I'm a gay cisgender male, member of Toastmasters, blogger. I do have a speech impediment, so if I get a little nervous, I do stutter at times. So if you hear me doing that, oh well. I love to travel with my husband, and I'm a certified HR professional. That's me. So next is the handsome John Baldino, who's wearing his hoodie because he asked. Good old USA. So John, tell us a little about you, and maybe your and also your social media.
Oh, I thought you were going to say social security number. I was like, Anthony, no.
Not
doing it. Thanks. Thanks for having me. I'm John Baldino. I run a great company called Humoriso. We are an outsourced HR consulting firm across the country, do some fun, great work, and I work with awesome clients. And, in this particular discipline that we're talking about tonight, I get the privilege of providing training and instruction on inclusion, diversity, equity, belonging, on the national level for SHRM as well. So it's awesome to kind of hold this banner up and keep the conversation going. So I'm a Philadelphia guy, married, 3 young adults. I'm not allowed to say kids anymore. So 2 are in college, 1 in junior in high school. So I'm just about done. Like they don't need me except to pay for things. That's it.
Very good, thank you. And your Twitter handle, Instagram?
Yep, Twitter is JB Alive. Like I'm not dead, I'm alive. JB Alive, and Instagram is the John Baldino, of course.
Of course. Very good. And Katee, how about you? Tell us a little about yourself.
Hi, Katee Van Horn. Thank you so much for having me. So I lead VH Included Consulting and Coaching. We're an inclusion, diversity, and belonging consultancy. So really, we help organizations build their strategy around D&I and then help them to implement it to make sure that it is a true lasting change and that we really are building inclusive cultures. We work with international clients and folks in the US, and we've really been able to make some great traction and help some folks really change their culture and the way that they show up and change their numbers as well. I speak internationally as a keynote speaker, and I'm from Arizona, so I don't need a sweatshirt, John. I'm good. It's 80 degrees today.
Oh, wow.
So, thanks for having me.
It's chilly in Jersey. Thank you, Katee. And last but not least, Janice, tell us a little about you. And again, thank you for being here today.
Of course. Hi, everyone. It's Janice. I see a few beautiful people that I know. I am a diversity, equity, and inclusion consultant. I've been doing consulting for a few years now, and the primary focus of the work that I do is around workshops and trainings in diversity, equity, and inclusion. I also give keynote talks on that topic, and I do a lot of writing around diversity, equity, and inclusion, and I try to focus on strategies to better our systems as far as like how do we implement trainings that are effective, because as we know, a lot of our DEI trainings are not effective. So a lot of the writing and the work that I do is around just improving the efficiency of our DEI efforts and initiatives. I also serve as a job coach for the Coalition for the Homeless in New York City. So I work with women who've been out of work for a considerable amount of time, and I help them to get back on their feet. And like Anthony, I'm a huge advocate of Toastmasters. I joined a few years ago, and I serve as the local director for my area, but I think if any of you listening are looking to better your public speaking, I'm a huge advocate for it, and I think it's helped me immensely to become a better speaker.
Thank you. And just Katee and Janice, just give us your Twitter and your social media handles.
Go ahead, Janice.
Mine is the same everywhere. It's Janice J Nice, so JANICE JNICE.
Perfect. And Katee.
On Twitter, I'm Katee Bar 7, so KATEEBAR 7, and on Instagram, I'm Katee Van Horn, also again with 2 E's, because my mom's crazy and likes to, have names like this, so it's good.
Perfect. Thank you. I get everyone, any attendees on, just make sure you follow everyone here because they're great people to follow. So one thing that I've been using daily with my colleagues at work, my own business, and on these webinars is really a mental health check. I think it's really important to really see where we are, and I love these heart ones. I think it's really it's simple, basic. So I think it's great to use. It's great all around for, it's just great all around to use. So for me, I'm personally right now at a yellow, so I'm doing okay. I've been doing pretty good. But been a solid yellow for the last week or so. So I'm okay with that. And how about you three? How about John, Katee, and Janice? Where are you guys at right now?
I would say I'm a red.
Okay.
Because I surprisingly, and I'm very extroverted, so at first it was really tough for me, and a couple of weeks ago I celebrated my birthday, so it was kind of tough in that sense. But for me, I've noticed that for the last few months, or year rather, I've been exhausted, and I always complain that I don't have enough time to do anything. And I always say if I had more time, I would do X, Y, and Z, and now I'm forced to do these things that I've been saying I was going to do. So for me, I've been really good with just the pause that I've gotten and just a moment to rest.
Katee?
So I'll say I'm orange right now. I think, I feel like there's some stuff that's being talked about now that maybe was put to the side, including this topic of, how are we thinking about mental health? How are we thinking about folks that are in marginalized groups? And how do we make sure that we're really keeping this conversation going? So the more that we can have these conversations, the more I'll rise.
Thank you. John, how about you?
I would say I'm a light orange. I'm starting to feel the distance. I'm an extrovert as well. I'm definitely a people surrounder typically. So I appreciate my family, but I'd like to go to a restaurant. I'd actually like to talk face to face with some other people. I'm missing that, and I think I'm a little melancholy at moments. It's interesting and I don't normally get that way. So to kind of experience a little bit of melancholy a couple of times during the day is a new phenomenon for me. But I'm okay.
And how do you all feel about this? Do you like this chart, like this simple mental health, like the way the hearts, and you like it?
Yeah,
I like it. Yeah.
Cool, great. So just what prompted me last time and this time to do the webinar really is what we've all been saying the last 10 minutes is continuing the conversation surrounding inclusion, equity, diversity, continuing the conversation surrounding race, racism, LGBTQ plus, disability, and also now we're really getting to ethnicity now also, because now we're seeing a lot of, and I go into this too, a lot of what's been called the Chinese virus, and how a lot of Asian Americans were getting a lot of lash from that term. So we're seeing a lot now with ethnicity being discussed. So those are what's really prompted me, other things as well, but those are the main things. And really the key, as Katee mentioned before, I think everyone else has mentioned really, is just continuing the conversation. So really, I mean, to me, when leadership in the political environment or arena started calling it Chinese virus, that really just ticked me off, because I really thought it was just a way of just trying to, get people riled up. But to me, really, this is not really a blue, left or right, conservative, liberal thing. This is just, it was just wrong. And this is really a global crisis, not just an American crisis, not just, it's global. We all have to face it together. And I think leadership needs to recognize that. What I wanted to do also, each of you had really great things that I liked, and there's many things. I know John now for the last, I don't know how many years, but there's a lot of things he does that I love. But most recently, he had a blog called Lean on Me, and as you can see on here. So I just wanted him to kind of go over what made you write it, tell us a little about that blog that you wrote about.
Well, thank you. I appreciate that. This was really born out of actually what we're doing right now. I think that for a lot of people, we've tried to quickly substitute this sort of Zoom interaction, the Microsoft Teams or whatever other tools you're using, to have the face-to-face virtually, but to sort of quickly jump into that virtual happy hours, those kinds of things. And while that, there's a place for that and it's all well and good, it's not a one-to-one. And there are certainly people who have, that I've even spoken with for sure, who feel like they have had a difficult time being authentic in how they're feeling, because this has been pushed so quickly that they need to kind of be that team player and let me get on Zoom real quick and be happy and how you doing? Oh, I'm okay. I'm a red heart. I feel good. But really, they may not be feeling that way. And the environment that they're a part of, they're not necessarily sure that they can be authentic, that they can be transparent. And so I felt like it really just drove me to write this post, and that we've got to be honest. I can't tell, from a distance on a video screen necessarily that you're not okay. I need you to tell me, because I may not notice otherwise. Janice and I are meeting, for the first time tonight, and it's awesome to meet her. But Katee, I've known for years as well. And so, it's a different dynamic, right? If it were the three of us, I may, Janice is smiling and happy tonight. I may just assume everything's great with her, but really she may not know what the lay of the land is to feel comfortable to say, I'm sorry, I'm struggling today, or it's been difficult for me to get out of bed in the morning. And to be able to be honest in that way. I think we as professionals need to be okay with that. People may, even what I just shared, I haven't said that, by the way, in public about being a little blue and melancholy until just now. So I think that would surprise people to know that that's crept up for me, right?
And good for you.
So that's really where this came from.
Yeah, I think Katee mentioned before.
And I think that
now bringing up the mental health.
Sorry.
No, that's fine. No, I think it's also true that the mental health aspect now is being discussed. I mean, it always was discussed prior to this, but now it really is. So I really, I do agree, and you're being honest, and I appreciate that, John. I think, Katee, you were going to say something?
Yeah, I think the other half of that is also asking the question. And, we do a lot of the, hey, how you doing? And move right along in the conversation, and pausing and really giving people that space to say, I'm not okay. Or, I do need a minute to just talk about stuff that has nothing to do with whatever the topic of the meeting is. Giving people that space is huge right now because there's a lot going on.
I really like what I just see what Ed Kim, hi Ed, wrote
Yeah,
in the
I just saw
chat.
that too.
And I agree, as a leader, one of the things leaders need to do is ask and check in. Asian Americans in the workforce via video or in person may not want to volunteer. So that's also, I feel like sometimes when things happen, we just assume that a person who is part of a group that is experiencing discrimination on a global, on a global scale is open and willing to talk about it. But I think it's also important to not assume that that is always the case. For some people, they might not want to discuss it. They might not want to relive that experience. So that's a really good point.
So I have a question.
Yeah.
How do you go,
And
if you're in a room of people and you want to kind of go through this, how would you go about doing that?
I would ask how people are doing, but I wouldn't probe. I think I have a tendency, especially because I'm a professor as well, to just probe and just say, like, how are you doing? And if I have a room full of students and they're quiet, I'll say, well, Anthony, how are you doing today? But, I've learned out of doing that, I had a student who was not having a good day, and she had a breakup with her boyfriend, and she was like, I almost broke down in tears when you asked me how I was doing. So now I don't do that as much, but I think I would invite people to share, but not probe like I normally do. Cause I think even for me, people have asked me things that I might not be in a space where I'm comfortable to discuss it. I've been on a plane and someone said, well, what do you think about this? And I'm just like, I just want to lay here and close my eyes. I don't want to think about racism right now. So I think just inviting people to share, but not, I would say not probing and not like forcing people to share things that they might not be comfortable with.
And I think that's a great point. I just would jump in and say as well that if your only outlet is in the group context, you may need to do some one-on-ones or one on a small group to open the door for that honesty. It may be too intimidating in the large crowd to say, Janice, to your point, how you doing? And people don't know what to say other than fine. But then if you do have those one-on-ones and someone does share something obviously more vulnerable, I think it's also okay to say, I really appreciate you sharing this with me. I wonder if others on our team feel similarly. Do you think that you might be comfortable enough when we get together tomorrow as a team to maybe share a little bit about where you are? Would that be okay, right? And to ask the permission to see if they want to tell their story.
Mm-hmm. Yeah.
One of the questions here is, what alternatives are there to "Are you okay?" or "How are you?" What other things can you ask besides those things?
I think those are actually okay questions to ask. I think it's more the inviting people, as both Janice and John mentioned. It's that invitation versus calling someone out or forcing someone to share. And I also would say, in those one-on-one situations, hopefully as leaders or as team members and peers, you do know them a little bit, and you're able to say, wow, that person maybe they're not being their normal selves. They're not sharing like they normally would. And so I think it's also just recognizing that and being very aware of who you're on a call with. But I also think for a lot of folks, this is brand new. So, being on a Zoom call, being on a camera, it is probably different. And it might just be that they're not really sure of the technology yet, or, oh, wow, you just saw my cat cross, behind my screen. Is that okay? Things like that. So I think it's also just, giving them space and inviting that conversation, but also, stepping back if they don't want to share, and that's okay.
Of course. So this leads me to the next, since Katee, since you're speaking, I want to go into you a little bit here. And I looked through your site, and I loved your storytelling aspect, and and being from the Navajo tribe in Arizona. And that's one of the things that when I do my presentations, one presentation that I really focus on is inclusion and being your authentic self. And I include in there storytelling and how we all really can get to know one another if we really know each other's story. And, and just kind of how we do that, how do we find the time. We have to just make the time. We have to just, maybe have an hour at work where we kind of just chill and just discuss where we came from, about us, and that really will lead to so much more engagement in future projects. So if you can just kind of like, tell us your story and all that kind of stuff.
Yeah. So, I think storytelling is so critical, and especially as leaders in this space. And right now, it's really, really important. And, Barry, just what you just shared, the piece about being vulnerable and really opening up to what's going on with you and being able to navigate those conversations and listening. I think a lot of times we do tell our story, or we have a story that we want to share, and stepping back and listening is just so important as well. But the storytelling and the sharing of who we are and where we're from, what our experiences have been, the different perspectives, that's also how we drive innovation and drive really that collaboration to get to the best thing with a group and as a team.
Absolutely. Thank you. And then I'm just going to go to my next slide. And then kind of continuing on actually with Janice too. When we were first introduced, she went into the DDD, Diversity Dinner Dialogues, and if you can, Janice, just kind of go into that, because I think it kind of does also correlate with storytelling, because it involves eating and all that kind of stuff. So if you can, just tell us a little about that.
Yeah. So it's been a really fun experience. I was doing these diversity dinner dialogues in New York City, and so during the diversity dinner dialogue, we would just focus on a specific topic. So Brian, who is on this webinar right now, Brian, Jared, and I are doing a diversity dinner for next week, focusing on white allyship. So each diversity dinner focuses on a different topic, because what I found is that food, as well as music, is really great at bringing people together. I love to eat. I love pizza, and I just love food. And I just find that in my work, what brings people together is like that golden thread that will hold the DEI work that you do all together. So if you can find, and I think all of us, no matter how different you think you are from someone, maybe you think someone is from a different part of the country or from a different part of the world, and they are of a different political party, I think we can always find things that we have in common. And I think that is what ultimately, like, the goal of the diversity dinner dialogue is for us to have like a really informal environment to just talk about things. And sometimes people have said to me, oh, I really wish you recorded the diversity dinner dialogues because I missed it. And what I found is that honest and openness that people feel is lost when you record the conversation. I think what's really nice is people have told me they feel like it's a safe space. There was, at the last one in February, there was an individual who came who actually shared with the group of maybe 40 of us that this individual belonged to the transgender community, and was sharing the story of, with being with a manager who didn't quite understand what it was to be transgender. So I thought that was so fascinating that you trust us as a group enough to share that, because I think that that's something really personal about someone. So that's ultimately like the goal, because I don't think we talk about things enough. And I think that diversity, equity, and inclusion, an important component of that is starting those conversations. And I think a lot of times we don't want to have those conversations because we don't want to make people feel uncomfortable, or we don't want to offend people. So it's really creating an environment to, like Katee said, tell our stories, because storytelling is so important, and just talk about the things that we are going through as a group and as a community.
Yeah. No, thank you. And I think I saw a comment here that virtual pizza is actually sold out.
Yeah.
How would one get involved with this?
So if you connect with me on LinkedIn, or if you I use Eventbrite to sell, even though they're free, to sell the tickets. So on Eventbrite, you can follow a group. So you could follow BWG, which is my company, on Eventbrite, or you could just add me on LinkedIn, because I always post whenever an upcoming diversity dinner is taking place. So it was really cool. I didn't think that that many people would sign up, but so that's pretty much how you can find out more about the Diversity Dinner Dialogue.
Thank you. Thank you all. So not gonna read it all, but as I said earlier today, earlier in this webinar, there's been a lot of ethnicity with issues along with lines of Asian Americans. So I wanted to just put a definition of hate crime. It's up there. So I'm just going to keep it up there for a few seconds and then go into the next slide. So there are other things I want to get to, but this is a general one that I found online on what a hate crime is. And then, in the Asian community, there have been, hate crimes ever since the pandemic, COVID-19. There has been an increase in hate crimes. And I think, the numbers will rise if leadership keeps calling it. Although I have seen it, the Chinese virus not being called that as much as of late, which is a great thing. It's never been called it at all, but nevertheless, I've seen less of it being called that. So hopefully that continues. And other groups too have seen hate crimes too. People of color, obviously, among other groups, Italians because of Italy. It was a widespread pandemic was there. The Jewish community also have seen hate crimes. But most recent, as far as Black Americans, I've noticed, this is an article that I read, I had to cut bits and pieces of it. But one article I read is now masks now are being are required. New Jersey had it, I think it was just required last week. New York just is requiring it this week. I'm not sure about the other states, but from what I'm reading, there are people of color that are nervous wearing masks, and some there was a footage of I believe this week. I'm not sure what store it was at, but a cop actually, I believe, told or arrested. I don't know the full story, but there was due for wearing a mask. So I just, I want to lay it out there. We don't really know the numbers right now of what's going on during COVID-19 as far as racial profiling. It's all going out. It's all going around right now. So we don't have the statistics to see really right now what's going on, but we know it's happening. So I just want to lay it out there. Have any of you heard anything as of late? Am I missing some pieces here? Have you heard more any racial profiling or any other groups that have been hate crimes towards any other groups at all?
I think the comment that I would add here is that we've had, obviously in the past few years, because of politics and a lot of other things, a rise in hate crime against all kinds of marginalized groups. And as we see this happening, and as social media is kind of that great equalizer in a lot of ways, because we're really seeing it happen and seeing it live, or seeing video versus just hearing a story. And I think the piece that is most disturbing is the thought of I cannot imagine being a parent and sending your child out in the world and being worried that because they're wearing a mask on their face, that might increase the odds that something bad will happen to them when they're just trying to protect their health. So, I think on this one, it's really just, how do we educate and how do we continue to help people and support people and be that upstander if you see something like this happening? And, standing behind someone, being there as a witness, all of these things are just so key as these things are happening, because we know they're happening and we're seeing them happen. And however we can support each other in this, we need to do that.
Absolutely. Janice, I'm sorry.
I think it's good that I'm always really grateful for social media, beside the fact that it's helping us to stay connected. I think it's putting these sorts of things in the spotlight, and without our camera phones and all of that, we wouldn't know that all of these things are going on. So I think that the more we talk about it, there's power in the visibility of it. And I think that that will help us to increase our awareness and try to come up with and develop solutions, because I think everyone's in agreement that it's wrong to profile people who are wearing a mask or wearing a bandana. So I'm just glad that this is something that's being discussed and talked about.
No, exactly. No, I agree. Yeah, that's why I wanted to raise it. And I know this has just come up recently, really, because the masks now are being required. I know people were wearing masks voluntarily before, but I know now it's becoming a requirement in many states. So I know I agree. I wanted to raise it out there and definitely continue the conversation on it. So let me just go to to kind of coincide with the last slide. There are workforce inequalities. A lot of the marginalized groups are delivering the groceries, are working in the pharmacies, are working, they're just many other things that they're doing for essential workers. So it's just something that we really have to pay attention to, and really just thank those people for doing what they're doing, and recognizing that there is inequalities. Maybe from this, maybe there will be some good in the sense, maybe there will be maybe higher wages for a lot of these essential workers. So I mean, it's obviously, I don't want to say any good, because there is deaths happening as we speak, and it's sad and it's just unimaginable. But I do hope the essential workers are going to gain from this. Any other comments anyone want to add to this?
Yeah, I I think one of the things that we have to be balanced in our thinking about, and the previous slide mentioned some of this as well. We have scientific evidence that persons of color, particularly in the Black African American community, have a higher propensity because of some other health-related issues. Even Dr. Fauci was talking about this with diabetes, asthma, and some other, I would say, systemic health issues that are found within the race. These folks also represent the highest numbers, in many ways, of folks that are out there on the front lines, whether that be nurses, aides, some of our distribution and retail workers. You mentioned, shop at home delivery, all that stuff. And so those worlds are colliding. And so there is potentially a higher incidence. We see that in the death rate, for there to be disparity for some of those minority related groups, persons of color groups. And we ought to be thoughtful about that in the way in which we provide resources to healthcare within those communities, because the need is obviously greater. I'm not saying that other lives don't matter. What I'm saying is, from a distribution of resources, we need to look at where we're seeing spikes, higher incidence. And I think that can, has to be something that we look at from an equality standpoint, to give people the more resources that are needed for a harder hit community.
Absolutely. Thank you.
Yeah, I think I was having a discussion with someone where they were asking me, and I didn't have the answer, how you change some of these more systemic issues, because we were talking about particularly the larger cities where there are more people of color, in like New York, Chicago, Detroit, where we're seeing higher instances of the virus. So what do we do? Some of these things are like, we can't change the fact that in some parts of New York City, for example, there are multiple people living in a very small space. How do we change that? We can't change the fact that there are these essential workers, many of which are people of color, have to travel to work, and they can't afford an Uber. They have to take the subway. Well, all of these things, and the fact that these higher propensities for certain comorbidities like diabetes, a lot of these people of color are also located in food deserts, so they don't have access to healthy food. So when I was having this conversation with this person, he said, how do we change some of these more like we as citizens don't have the power to make some of these more systemic and structural changes, and how do we do that? And I didn't have an answer, and I thought that that was a great question. Maybe one of you guys has the answer, but it's a really interesting thing to think about, is some of these more systemic, how do we change some of these more systemic issues that have allowed these numbers to be seen in some of these communities?
Katee has the answer. Katee has it.
One of my answers would be with your vote, who are you voting for? Who are you putting in office? And then also term limits. Can we please get term limits?
Yeah.
There should not be lifelong politicians that are just really gaining all kinds of things when they're not really doing the work. So I that is all. And yes, I'll stop.
Well, and I'll come at it from the capitalistic approach. We must, as consumers, support those companies that are putting these issues at the forefront. You know, Janice, you brought up a great point even about the food deserts. There are companies, food service companies. Of course, right now it's all on hold because of the mandates. But there are organizations that are quick serve restaurants that, and there's a company, and I'm blanking on the name, that's out in California right now. They are doing planned restaurants, quick service in various communities in Southern California. Some of them are in what's classically described as a food desert area, and others in areas where it's, food is very accessible and commercialism is there. They are charging more for their food in those areas where food is aplenty, and a lower price point for the same items, a dramatically lower price point in the food deserts, to give people the opportunity for these healthy options. And they're allowing the commerce to sort of balance out what they'll take in as a whole. They're looking at it as one unit, even though it's multiple locations, if that makes sense. We have to support companies like that in order to make that difference.
Absolutely. And there's a chef here in town, Chef Silvana, and she has been kind of begging all of her peers in the restaurant industry to be making food for healthcare workers, to be making food for underserved communities. And it's a movement that she's creating. And now people are just sending her money. She was taking pictures, on her Instagram of people throwing money over her wall, just so that she can make more food for these communities that need it. So it's really important to, like you said, John, support those folks and help keep their doors open after all of this is over.
Absolutely. I just wanted to, just for people that are on, if someone witnesses a crime, a hate crime, or any kind of discrimination, harassment, I know you can obviously reach out to the EEOC, contact Human Resources, local police. Is there anything else that I'm missing there? Or, any suggestions if someone witnesses something like that?
I think oh, go ahead, Janice.
Oh, I'm sorry. I was going to say, I think this highlights the need for, within organizations, people having bystander training. I think a lot of times we witness things that would be considered maybe not hate crimes, but discrimination, and people don't know how to address it. So making sure that leadership and employees have adequate training so they know how to intervene if need be when they are in these situations. Because I think a lot of times when they happen, that people are afraid. We have, bystander effect and things like that. People don't want to be the one to say anything.
Absolutely. And I think for the trainings that we have done recently, we're actually changing the language from bystander to upstander. And it's, a very subtle difference, but it is because of the fact that no, you can't stand by and watch things happen and not get involved. And yes, it can be scary. And yes, it can be intimidating. Obviously, never put yourself in harm's way. But this is really about, being another voice, another set of eyes, another body that's there to just help support folks when these things are happening. I think we've seen so many different videos in situations where people have stood up and said, no, this is not okay. and, kind of offer that protection, offer that I'm going to sit next to you on the subway, whatever it might be. And it might seem like a really simple thing, but if we're all doing it, we will shut that down. And this activity that is happening, it's not okay, but we need to be the folks that say no.
Yeah.
I think it's like if you ever take the subway in New York, they have the signs that say, if you see something, say something. I love that. And I love the idea. And I see someone put that. They also love Janelle said she loves the upstander concept.
Yeah.
So that's really important.
And I'll just add to this, Anthony, I think it's really sweet that you've listed human resources as a place to go. But I don't know that I believe that for all of the organizations, some of which we may work for, for some of the folks that are on this Zoom chat tonight. HR may not feel like the right place to go, and that's unfortunate. That has to change because I appreciate the fact, and I'm not foolish. I've been around too long, right, in HR. I get that we have a responsibility to the company. I appreciate that, and we do need to protect the interests of the company. But standing up for equality is part of health for the company. So when we let it go, we're actually undoing the very value we say we're upholding. It's foolishness. We have to be able to say something. And I promise you, I appreciate that I have a bit of a jerk personality at times. I'll own that. I get it. I have had to be the one, though, that sits with a CEO and says, listen, if you talk to that young lady again, like I heard you talk to her, I'm going to call your wife and ask her to come in. And I'm going to tell her what you said and get her opinion about whether that might be okay or not, because she may do worse to you than I ever can, but I want you to know it has to stop right now. So you decide whether I'm making that call next or not. You may not have the right to say something like that to your CEO if you don't yet have the relationship, but I'm going to ask you to stretch a bit from where you are right now. If you're in HR, stretch a bit further.
Perfect. So I just have a few questions that I came across that I thought would be good to include here. So how do leaders and organizations lead inclusively during these distinct times? It's hard because we're all on a camera or on video, but how can organizations be more inclusive during these times?
I really like what I've been seeing some leaders doing is where they're donating part of their salary, their annual salary, to people who they have to lay off, or so their employees, I'm sorry, so they don't have to lay them off. It's been interesting because I've seen the opposite stories from different leaders where they're expecting employees to take their sick leave or their vacation days and things like that. And I think now people are paying more attention than we normally would. So now is really the time to show the world that you care about your employees. Because what you do now as a leader, I think, is going to reverberate when all of this is when the dust is cleared from all of this and things sort of, I don't want to say go back to normal, but when things get better. So what I like is that I've been seeing leaders make sacrifices to help their employees and to not have to fire them. So that's something that I would consider courageous leadership. And I admire the leaders because that's not something they have to do.
Absolutely. I 100% agree with that. And I think kind of building on that, I think it's also the companies that have shifted what their product is to, start making masks, or we had some breweries here in Arizona that started making hand sanitizer, which worries me, but that's a whole nother beer are we drinking, but that's okay. But I think it's really, to Janice's point, we're watching and we're really aware of what some of these organizations are doing and what action they're taking. And it goes back to, how are we going to support them in the future? Are they someone that we're going to spend money to buy their product? Are we going to support them if they have made not so great choices? So, being aware of who's doing what and how they're really helping their employees. And I think the other piece, and we kind of already talked about this a little bit, is Zoom can be exhausting, and being on camera all day can be exhausting. So having grace that, you know, someone might have to step away to take care of their child or whatever it might be, understanding that there are a lot of distractions when folks are at home. This is not a normal work from home. This is working from home with children running around the background that may or may not be trying to figure out their own schooling situation on video. And, you know, everyone's in a tight space, that type of thing. And so really being cognizant of that and just showing grace that they're not going to be top performing right now. We don't need to worry about their annual review right now. We need to focus on, are they okay?
Yeah. Yep. Yep. And I would say, I agree with all of this. I just would add, at the most basic level, ask your staff and team members, what do you need? What might we not be considering at this moment? You've heard us offer suggestions. Are we leaving anything out? What other ideas do you have? And again, if someone isn't comfortable in a large group to do that, you need to go and make those appointments to speak one-on-one with some of those folks to say, I know you didn't share anything when we were all together. I really would love to know any thoughts that you have that, you know, we may be leaving out. We don't see everything. You may be seeing something differently. So just being intentional that way.
Yeah. And as there's some comments here, corporate social responsibility and inclusion go hand in hand. Other things are in here. We are not working from home. We are trying to work in the middle of a pandemic at home. So yeah, there's a lot of, you know, and even with, you know, with me, you know, I definitely have learned to have more compassion and more empathy towards other people. My empathy, I'll admit it right here, can be lacking sometimes. And I am learning to, during all this, I am learning to be more empathetic towards family, friends, and loved ones, all that. So definitely, you know, you can also add that too there, being more, you know, leading more inclusively is being more empathetic, being more compassionate, asking the questions, how are you? And really mean it too, not just ask, just ask.
That brings up a great point, Anthony, is just this is actually a little bit of a great equalizer in some ways, that we're all being challenged in different ways from working from home or having challenges with how do we get groceries and things like this. And so I think the empathy is kind of coming because we're all experiencing it, and just being aware of that we might have challenges in our home, but who knows what the challenges are in someone else's home, and just being cognizant of that.
Definitely. And just leads to another question, how can organizations adjust to D&I that were once in person and now being done online? So, I mean, right now, one way is having panels and Zoom. You know, I mean, really, right now there isn't much more. I mean, webinars. I'm not, you know, I guess you can do like Janice is doing the DDD where you know, do a virtual pizza. I know HR Social Hour has their movie night. It's not. I mean, listen, they're not D&I conferences, but they're certainly inclusive. Have everyone kind of together in a virtual sense. Any other ways you guys can think that how we can adjust the world?
I'm sorry.
No, Dennis, go ahead. No, go ahead.
What I've seen that has been unfortunate is that all of the workshops that I had scheduled for May and June were all canceled, not even put on hold indefinitely, but canceled. And I think that there are still ways that, and the companies have reached out and said, we don't know what our financial situation is going to be, so we don't have the money to invest right now in diversity and inclusion, which to me is just a little bit worrying, because I feel like it's definitely a necessity, if not now more than ever. And I just wonder what message that sends to the employees if you had all of these things planned and now you're like, oh, wait, this is not a priority right now. I understand one end of it, but I also think, like you said, Anthony, they can be doing panels. Panels are free. You could invite, you know, D&I professionals to come and speak and for your company, and that it's not the same as an in-person workshop or as a training, but it still shows that you're making an effort. So I think that it is problematic when you put the fact that a lot of companies are putting things on hold 100%. And I understand, because we're kind of in this like limbo. We don't know how long things are going to last and what ultimately our financial situation is going to be. But I do think that it's problematic, and I'm sure some of you guys may have experienced this. Maybe some of you participants have experienced this, where companies are like, nope, we're not doing D&I anymore. So I think that we should still keep the momentum going by doing panels and webinars and things like that.
And Janice knows too. I'm in the process of trying to get all D&I leaders, like from the hotel industry and travel and tourism industry. I'm trying to get a D&I leadership thing going on where we can kind of continue these conversations. So Janice is involved, and obviously John and Katee, I'll also let you guys know when that will happen. I have to admit, I keep saying guys. I am sorry.
I know I do that too, and I need to stop.
I keep saying it, and I
do that too.
One thing I need to learn is stop saying guys and say folks, or it's again, I apologize to the attendees and the panel if I keep saying that. That's one thing I need to learn.
Me as well. Ed said, where there's a will, there's a way.
Yeah.
And
I think companies will make
expressing these vulnerabilities is making it known.
Well, and I think too, Janice, makes a great point. Certainly, there's financial considerations that companies have to figure out. But when you say we're not going to be doing any inclusion and diversity programs, is that supposed to mean that that's not a value or a consideration anymore? What's the real message there? And I think that's something that we can challenge. It doesn't cost us anything to challenge that, because we certainly aren't saying things like, okay, no more paper for the copier, because we don't know if there's going to be budget. Right? How come we need the paper. Oh, right. And so then you can start to have that dialogue to say, so we don't need, well, you know what I mean. No, I don't actually. Maybe I don't know what you mean. The other thing that I just want to mention too, Anthony, in answering this question, we still have organizations that we work with, for example, and I know there are others, and I saw Jerry Crispin was on the call. I don't know if he still is, but I noticed him on the list earlier. And, there's organizations that are doing a lot of hiring right now, believe it or not. And so how do you weave in DE&I considerations to your hiring process when it's almost all being done exclusively online? That may be very different for some organizations. So they are going to need some training. They are going to need some accountability as to how that's being done. And so I just want to kind of put that out there for those folks who may be on this or listening to this later. If you are doing a lot of hiring right now, you need to have some help brought in to help your hiring managers who are now doing this from a distance. And what those tweaks might need to be to maintain a high level of inclusion and equity considerations.
Yeah, I think I saw a comment in here about unconscious bias training, which you can do obviously virtual. So that's something to consider that if anyone on here.
It's not even unconscious. I'm telling you right now, like I'm interviewing you and you've got junk behind you. You haven't folded your laundry that's on the couch behind you on this Zoom interview that we're doing, right? What is that telling?
No,
I'm so sorry.
I know I had to look.
Right? Like we are shallow if left to our own devices. So you have to challenge that.
Of course, no, definitely.
I'll just add just real quick. I know we're almost out of time, but I think the other piece is there's a lot of free resources out there. And I think a lot of folks in our community that are D&I consultants are offering options to just be there and help support in some of these ways. Now, obviously, we do have to get paid for it, but we're also offering a lot of free resources right now because we want to make sure that we don't slow down on this journey. We just recently published an ebook around storytelling with Stories Incorporated. So if you're interested in that, how do you tell the stories of your employees? Reach out to me and I can get you a copy. It's stuff like that we're trying to do so we're still having a conversation and not slowing it down because of what's going on. It's important.
And yes, we are almost out of time. So I kind of skipped over the last slide. I kind of played it for you all to see. But the last, there's a few more slides after this. But one more question is, and we kind of have answered, I guess, in a way, but how are you all handling anxiety, fear, and stress? I mean, me personally, my husband and I go for a walk every day at 4 o'clock, regardless. I mean, obviously, if I have a conference call that I have to be on, or if I have to be on a call, but if I don't, him and I go with our dog for like an hour walk, because it just, you need that. Although I'm about to kill him too, but
The dog or the husband?
oh, but you do need to get that fresh air, the sun. Hopefully, if it's not raining out. So what are the three of you doing?
So I am very blessed in that I'm in Arizona and the weather is phenomenal right now. And so I have been taking calls outside and making everyone else on the call jealous. Taking lots of walks also, and just getting outside as much as I possibly can. And even just getting in your car and taking a drive. And I know some folks are not allowed to do that right now, but I just found that it can be slightly off-putting in that you're driving around and seeing empty parking lots and things like that. So it is scary. But I think the other piece is giving yourself space to not be okay, to, have a crying jag if you need to. And if you need to be by yourself for a minute, stepping away from, or as much away from your family as you can. So all of those things I think are huge. That's what I'm doing.
Yeah. For me, what I've been doing, it sounds weird, but I've been, I love diversity and inclusion, and I just love to write about it and do the work. And I've been offering these free or complimentary webinars for companies, because I myself wouldn't say I'm proficient at webinars at all by any means. I'm used to in-person workshops. So it's been kind of fun for me to work on these complimentary webinars for these companies, because it allows me to practice doing them online, but it also helps to kind of take my mind off of what's going on. So it almost feels like, not saying that this all isn't happening, but it gives me something to really focus on. So I would say focus on doing things that bring you a lot of joy. And for me, that's like crafting webinars and writing and doing things like that.
Board games, jigsaw puzzles.
Oh yeah, puzzles.
Yeah, puzzles have been doing very good. I've seen that. They've been selling, I think, I don't know, like 20 every, I don't know, a lot.
Don't buy the ones from Five Below, because all the pieces are the same exact cut. It's a nightmare. Don't do those.
Okay, so don't do that one. Okay. And as everyone's talking too, I was just kind of going through my slides. I want to be respectful of everyone's time. It's actually at the moment where we end. So I just wanted to, and this mindset shift during a pandemic, this is just stuff that I've put up. Again, this is recorded, and if anyone wants a slide deck at all, just email me, let me know, or maybe I'll just send it out to the list of people that signed up. And I just want to, again, thank you for the panel. Thank you all for joining. Thank you attendees for joining. Just one thing, I know we have a little, we are, obviously we're home and we can do many things. One thing I do recommend is taking the IAT tests. It does help you, recognize your biases and whatnot. So I definitely recommend it. The website could be a little long, so you could just go to Harvard, or, go to Google, whatever site, whatever search engine you use, put Harvard IAT, you can go on there for that. And there's many different kind of tests. And just sites to go on. The first few sites are my panelists from last time. Going in the middle, I have John's site there, humoriso.com. VH included is Katie's site. BWGbusinesssolutions.com is Janice's site. Other sites are on there. Please use them. We've kind of, there has been some questions, but I know we've been kind of going through them as we've been talking. I also want to thank you to all the medical workers, first responders, and everyone on that list. It'll take me an hour to go through it all, but that's, I want to thank everyone for being a part of this and helping us all out. It's another slide. And just my information. And there are some comments coming up, but we are out of time. Again, I want to be respectful to John, Katie, and Janice. Again, thank you all so much. You have our information. Any questions you have for the panelists, you can feel free to email them. email me, whatever it is. Have a great night. Be safe. Thank you, everybody.
Thank you, Anthony. Thanks,
Thank
Janice.
you.
Thank you. It was
Thanks.
great to meet you all.
You too. Thank you so much. They're gonna watch. We got to watch me get off this thing now. Which you might just stare at me the whole time on the internet.
First, stop recording.
Oh yeah, that would help.